Board of Health, Carson City, Nevada. It's 2 o'clock on Thursday, September 17th. Thank you. I need to remember these things. Click. Roll call, please.
Sheriff Furlong.
Here.
Supervisor Boud.
Here.
Supervisor Bankowski.
Here.
Mayor Kroll.
Here.
Supervisor Bagwell.
Here.
Supervisor Scherp.
Here.
Dr. Pintar, we have a quorum.
Thank you. All right. We will open it to public comment. Any topic of discussion that the public would like to bring at this time? Hearing none, I will move on to approval of the minutes of July 16th, 2015, which should have been included in the packet. I have not heard of any corrections. Are there any to be brought forward?
I move to approve the minutes of the Carson City Board of Health from July 16th, 2015 as presented.
Second.
Thank you. Move and second has been made. All approval, aye.
Aye.
Those opposed? Thank you. Motion carries. Mayor, would you be so kind as to make an official proclamation?
I will. I'll go down
Thank you.
here.
Thank you.
It's my pleasure to read this proclamation. It's called the Official Ride for Reading Week Proclamation. Reading Week. What did I say? Reading Week?
That's important too, but that's not what we're here
right.
for.
Whereas literacy, we got to work on that one. Whereas literacy is the foundation of our ability to read, view, write, design, speak, and listen in a way that allows effective communication. And whereas early formative experiences with language, stories, and print have a lasting effect on all learning. And whereas children need access to books, ideally books in their home. And whereas bicycles are a healthy, effective, efficient, and desirable form of transportation. And whereas modeling self-cycling behavior for children can encourage them to practice safe cycling behaviors themselves. And whereas volunteers will share their love of cycling and reading with elementary school students by delivering books to schools via bicycle in Carson City. Now, therefore, I, Robert Kroll, Mayor of Carson City, do hereby proclaim the week of September 28, 2015 as Ride for Reading Week.
Reading.
I did it again. I don't know, Sheriff. Maybe I ought to go to jail, huh? Ride for Reading Week in Carson City. Courtney, on behalf of the community, please accept this proclamation and tell us a little bit about it, would you?
Thank you, Mayor Kroll.
Let me go back up to the podium.
Ride for Reading Week is going to take place in Carson City. This is the second Ride for Reading Week in Carson City. The first one was in May of 2014, and we're thrilled to bring this event back to Carson City. It's so nice to have a board who is so supportive of physical activity in our community. It was nice to see all of you at the opening of the Ash to Kings Trail. The purpose of this event is to keep that going in Carson City by creating a new generation of Carson City citizens who appreciate biking and walking and all the resources that we have here. So to promote bicycling and also literacy, which is something that's so important, we'll be doing 3 deliveries in Carson City for Ride for Reading Week. One will be on Tuesday, the 29th, to Fritch Elementary School. One will be on Wednesday, the 30th, to Boardwick Bray Elementary School, and we'll be doing one on Friday to Fremont Elementary School. Those are all going to take place in the afternoon. We'll have the details promoted in the newspaper and online, of course. But we certainly want to invite everyone to participate. If you need a bike, let us know. We'll have bikes. We've got trailers. You can pull a trailer full of books. You can put your books in a backpack. It's truly a fantastic event. When you arrive at the school, the kids are all outside and they are screaming and cheering, and they're so excited that we've taken time out of our day to come and talk to them and give them each books that they get to keep. They're their very own books, and they each get 2 books to take home. And so it's so valuable for promoting learning and also for modeling the safe biking behaviors that we really want our kids to have.
Thank you. And as always, thank you for your enthusiasm.
No short.
Supervisor Bonkowski and I have now agreed that not only will we, I can walk and read together. I know that's a very special skill, but we have agreed that we're going to try to learn how to ride our bike and read at the same time without getting involved in any traffic accidents. So.
Yeah, Cheryl?
Don't look at me. I want
Thank you. Let's see. Oh, my report. Relatively brief. There's just a few things that have been going on. The sexual assault, local sexual assault exams has been a little bit of slow going. We have not yet gotten contracts from a medical director or an examiner, sadly, but those are being worked on. The room is being prepared, so we've had to move back our proposed start date. Right now, we're hoping for October. As an aside, but a related aside, the number of sexual assault exams has decreased slightly in our community over the past year to date. However, the number of what are termed accompaniments, which are when somebody from advocates who is asked to accompany a victim who reports a sexual assault, unfortunately, those have had nearly about a 15% increase year over year. And so I think that just lets our community know that the problem of sexual assault is still quite active, unfortunately. The other thing I did was go to the Carson City School District and talk about immunizations. We're making a concerted effort in our town to get every child who is enrolled that they must have their immunizations up to date at that point, not within the school year, but prior. The Health Department clinic has had some open immunization hours that were quite well received, where I think it was 400 something kids came through to get immunized. And another part of that is that Carson City School District is also opening a school-based health clinic behind Gleason School that will start open in October 8th, and be open initially 2 days a week. And a big part of that health clinic should be the delivery of immunizations as well. Just to tell you a little bit more about it, it's for any child within the Carson City School District. Their families can also avail themselves of the service, and all forms of insurance are being accepted, as well as a sliding fee schedule for the uninsured. So I think that from the standpoint of a health promotion and improving access to health and behavioral health services, it should be real positive for the community. And then last but not least on my report is we're going to talk a little bit later about our public health accreditation progress. But today will be our first lesson as a board in how to impress the examiners when they arrive in February.
Susan, can I ask? If I could ask the city manager just to give us an update on the progress of Dr. Hess heading up the SART team of nurses.
Yeah, I can give an update on where we are, not only with the doctor, but with the SART program in general. Dr. Hess will be brought on as a temporary city employee. That'll allow the city to be able to cover her with our insurance. We should have that part of it wrapped up pretty quickly. Where we've got one of the three nurses that we need. The only couple items that remain are getting the table finished, or I'm sorry, the exam table finished. That had to be reupholstered. Carson Tahoe Hospital is also getting the remainder of the equipment in the room. So I think we look good to have an initial operating capability in mid-October at the latest. In order for us to be fully up and running, I think we're going to need 3 to 4 nurses available. Each one of them will be able to rotate in terms of being on call, but we'll at least have the medical director. We'll have at least one nurse appropriately credentialed. We'll have all the equipment in place. We'll have the protocols in place, and we'll be able to start doing our own SART exams mid-October.
And then the only other question for anybody that's watching, if someone wants to be one of those nurses, who do they contact?
The easiest way would be to contact me. I chair the sexual assault response team. And so if there are nurses who are interested in receiving the training, we have some resources for that training. But I know that there are a number of nurses in the community and in Northern Nevada who have already received the training and are awaiting clinical training, and we have opportunities available for those people. So if they are out there, they can certainly contact me and we can get them on board. Any other questions about my report? All right. Do I need one? Okay. Yes, please.
I move to accept the health officer's report and give direction to staff on CCHHS activities.
Second.
Motion and second have been made to accept my report. Those in favor? Aye. Opposed? Thank you. Motion carries. And now I will introduce Dustin, who is known to you all, Dustin Booth. Nikki, who is our manager of Health and Human Services, has been called out of town for some family health-related issues. And so Dustin is stepping to the plate. Hit it.
Thank you, Susan. For the record, Dustin Booth, Division Manager at Carson City Health and Human Services. I also have Mary Jane here, and we're going to present the Director's report.
Okay, for the Human Services Division, this is Mary Jane Ostrander, Division Manager. And I just kind of wanted to touch base with you guys and let you know our Community Action Agency designation. Back on or about 2005, the Human Services Division reorganized its designation as a Community Action Agency. Agencies must meet the following criteria to be considered a Community Action Agency. One is community-wide assessment of needs and strengths. We need to have that ability. Comprehensive anti-poverty plans and strategies. Provision of a broad range of direct services. Mobilization of financial and non-financial resources. Advocacy on behalf of low-income people. And partnerships with other community-based organizations to eliminate poverty. So annually, we have to prove that we're still meeting all those designations, and we have retained our Community Action Agency status. One of the other things is we do need to have our low-income population be representatives in our planning and implementing processes, and we do have 2 low-income people on our tripartite board, and their feedback's just wonderful. Our CSBG, our Community Services Block Grant, is our funding through the state of Nevada. It does fund one of our full-time workforce program case managers, helps us fund our office specialists, and it also supplies our office supplies, operating supplies, and direct services for clients. Just an example, some of the direct services could be somebody needs steel-toe boots in order to accept this job and get to work. We could probably purchase those. So that is some of the things that it can fund. The Human Services staff, we've been busy developing our organizational standards as required by the Federal Office of Community Services. And some of the standards, or all of the organizational standards, have been in the core capacity as leadership, financial management, consumer input, governance, human resources, community engagement, strategic planning, and community assessment. We are proud to say that we are 80% complete. Our deadline is December, so we are right on target and should have everything in place. The only 2 things that we have left are our strategic plan, which we've kind of been waiting for the cities to be in place, our departments to be in place, and so we'll just flow right in there. And the other thing is our community needs assessment. As many of you guys know, Salvation Army has just conducted a very comprehensive community needs assessment. We have done a community needs. We're going to kind of merge those together and see what the needs in our community are. And that's where we're at. I'm sorry, I have one more slide. We do have our next job fair, September 25th. from 2 o'clock to 4:30. 1:30, it opens up for veterans looking for work. So we're excited about that.
So for our clinical services division, last month was very busy for them. During the first 2 weeks of August, we offered extended hours for back-to-school immunizations. During that time, we saw 324 individuals, and we gave out 618 vaccinations. It's a little bit less than last year, but we still had a good turnout.
Dustin, is that because individuals got multiple vaccinations?
Yes. You mean what, the 300 versus 600?
Right.
Yeah, the answer, the question is, how come the numbers are different? And most children entering school need to have 4 vaccines. So there'll be some who just need a booster, and then others who get 4 shots.
So the overall number the differences between those two, but the overall number, we saw 324 this year. Last year we saw 355 individuals. So it was we saw less individuals, but it wasn't really that much of a difference from the previous year. As Susan mentioned earlier in her report in regards to immunization compliance, she met with the board, the school board, regarding school immunizations compliance, and also our clinical services manager, Ronnie, met with the Carson City chief school nurse and nursing staff, as well as Douglas County chief nurse. We clarified and outlined interim processes for the school year and future processes for the 2016-2017 school year to ensure first day of school exclusion for any student not up to date on their vaccinations. Another area that our clinical services is involved with is the state's Maternal Child Health Advisory Board, and Ronnie, our manager, she is part of that board. In 2013, she was appointed to that board. For the past year, she served as the vice chair, and this year she will assume duties as the chair for the advisory board. This will be in November. NRS 442.137 outlines the purpose and the objectives of this advisory board is to advise the administrator of the health division concerning prenatal care and to enhance the servability of health of infants and mothers and concerning programs to improve the health of preschool children. So it's pretty exciting that we have somebody from our department on this state level board. Here is the important part. This is showing the Carson City showing a trend from 2010 to 2015 of influenza. You could see the red line is the 14-15 influenza season, where influenza season goes from October 1 through September 30th, and so we're finishing up this season. We don't see a lot at this time of the year. Usually we see it, as you can see in the chart, December, January, February. Last year we saw a tremendous increase of the number of influenza reports provided to us. We will be publishing our report on our website by the end of this month. And one of the things that we're going to do, we're going to send out a letter to all the physicians this year asking them to, when they report influenza, asking them to report one additional measure we'd like to monitor, and is that if the person's testing positive for influenza, find out if they've received the flu vaccine this year or not. Last year, we know that there wasn't as good a coverage, and so we're just trying to see if we can capture that information on the ones that are reported to us. Here's some information in regards for the environmental health program. It's food establishment follow-up inspections. So inspectors go out and do routine inspections. When they do those routine inspections for compliance with the food code, we categorize critical versus non-critical. Critical violations are ones that are more likely to cause foodborne illness compared to non-critical violations. Most of the time, critical violations require a follow-up. It depends on if they can correct it on site or not. So what I looked at is that how many follow-up inspections are we doing, and is there any correlation to the number of critical violations that we're finding? And so you could see in 13, the biggest year that we had the most critical violations, we did have the biggest follow-up inspection to those establishments.
question there.
No problem.
So when you say critical violations 11%, it could be an individual establishment with 5 violations. So I don't want
Correct.
people to think that we have 11% of our food businesses have critical violations. Correct?
Yes. So those are the overall. So in 2011, we had a 1% follow-up rate with 13% critical violations. We had 685 inspections, and so some inspections had no violations, but other inspections may have had multiple critical violations. So it doesn't reflect. There could be some very bad establishments versus very good establishments.
Dustin, a question on this as well. The way I'm looking at this, they're actually in reverse order. You're doing an inspection, you're finding a critical violation, that's the percentages on the bottom, and then there's follow-up visits on those, not the other way around. So,
Yeah. So those are
so the bottom numbers are not the number of critical violations found on the follow-up visits?
correct. No.
Okay.
Yeah, those are the critical violations are found on the routine inspection. Then we follow up to make sure that those critical violations are taken care of if they could not be corrected on site during that. So some of them are easy to be corrected on site, but they're still a violation. So for instance, like one that if they didn't understand how to properly set up a 3-compartment sink for sanitizing, we would give education out there, show that they would do that. But say a dish machine that was not properly sanitizing, that would have to. Sometimes we could follow up in the later that inspection, depending on how big the facility is. But a lot of times we have to follow up the next day because they have to get their service contractor out there to fix the problem. Or if a refrigerator was down, they were not fine. If a walk-in cooler was down, we would work with them to abate the situation immediately, and then follow up with them once that walk-in cooler was back up at proper temperature. Our public health preparedness program from June to August has been busy doing lots of things in the community, but two of the biggest items that they've been doing, currently they're doing school-located vaccinations and community flu clinics. There's some flyers on the table as you enter in regards to our community flu clinics that are available, and then staff have coordinated with schools in the region to do immunizations in the school. And we're also the last week of this month of September, we will be participating in a statewide exercise in the deployment of the Strategic National Stockpile. We'll be going down to Vegas, where they will actually fly in the Eagle package to Southern Nevada, and it'll be deployed out. It's not real medication, but there'll be boxes that represent real medication. It'll be deployed out through Southern Nevada, through Clark County. Some other items that the Public Health Preparedness has been doing is they've been out at National Night Out. They've put out first aid booths at Carson Valley Days, at the Nevada Fair, and at the Aviation Roundup. We've also did a presentation in regards to the overall health department services at the Rotary Club. And we're also working with the remote area medical events in Northern Nevada to help promote that. And we also usually provide some staffing for that event. And that event will be in Carson City on October 16th through the 18th. Our chronic disease and prevention and chronic disease prevention and health promotion division, our Ryan White program has been working on their care binders. They continue to be distributed, and we're working on an internal QI project about that. Our adolescent health education program in August, they were Story County accepted them to be to teach the curriculum in their schools, and so September 30th marks the end of the original 4-year grant period, and then funding for the FAT program has been extended through September 30th of 2016. In Story County, it'll be taught at the FAT program will be taught at the 5th and 8th grade levels, and then a program called Be Proud, Be Responsible will be targeting 10th graders at the high school, but also some of the upper grades will be able to attend those classes since this is the first year that we're rolling that out.
I just wanted, for people who aren't familiar with the Ryan White program, our health department has essentially the statewide contract to follow up with folks who are HIV positive to help them hook up with the appropriate medical care, make sure that they understand the need for primary care, specialty care. So these care binders are something that the program manager for the Ryan White program is developing specifically to help these HIV positive folks across the state. So it's not, HIV is not a large problem in Carson City, but statewide, it's rather an honor to be the one designated to help these folks receive the appropriate level of service.
Another program in the prevention and health promotion is tobacco. So we continue to promote our quit line at 1-800-QUIT-NOW. We've partnered with Western Nevada College to help eliminate secondhand smoke exposure on their campus, and we're starting to assess apartment complexes to look at their willingness to be smoke-free or to be partially smoke-free. And then Courtney, who was here earlier, she does our Safe Routes to School program. She's got our Ride for Reading coming up here in Carson on September 28th through October 2nd, and in Lyon County, October 5th through the 8th. October 7th, we'll do across the nation, students will participate International Walk to School Day.
I was going to add a little bit to the tobacco. There's some interesting research lately that showed that among children who start to use tobacco, if their community has signs like in the public parks or at playgrounds or in these apartment complexes that are prohibiting smoking, just the presence of those signs in turn decreases the numbers of children who start smoking. It was kind of an interesting correlation, but they looked back. And so if the idea was if children perceive that tobacco use is not part of their public, their community doesn't agree with tobacco use, then they have lower rates of starting tobacco use. So anyway, I thought it was interesting.
Just a quick update on some. These are currently some of the quality improvement projects that are working on internally in the health department. I mentioned earlier the customer satisfaction regarding the Ryan White Care Binder, our online version of our food handlers test. We also have some clinic procedural manuals and cross training between clinic sites. And we're also open to any suggestions that the board may have in regards to quality improvement projects within the health department.
And this is where, when as members of the board you get questions from constituents or others that the health department needs to know about them to examine their processes, and often there's a quality improvement project that results from that. Segue?
I think that's me. Okay. I've had some questions concerning, the recent fires and everything that we had. Where is it that residents of Carson City can obtain information about our air quality so they know whether to wear masks or stay inside? Or they constantly see it in the Gazette Journal about Reno, but how do our residents find out about air quality?
Carson City Health and Human Services does not have any local air quality. However, the state of Nevada does provide that service for our community. They have one air monitoring station in south part of Carson. They also have one down in Gardnerville too. They have real-time air monitoring that's available on their website, so individuals can go out and look at that. I do not know what that website is offhand, but it's at the NDEP, Nevada Department of Environmental Protection's website. They have their air quality division, and the monitoring station here in Carson does have real-time data that you could go out and you can look at. What we do internally during the really big smoke events, because we do receive a lot of phone calls, we will monitor that and monitor to see if there's any press releases from the state, and then also work with our partners up at Washoe County in their air quality division and ask them advice about what we should be giving our citizens.
So is that something maybe we could have a link to that air quality website on yours so that people, when they come to yours, could just link right into that?
Yes, we could have a link put onto our...
A simple fix, but at least our public could be informed?
Yeah, one of the easy things, Lori, that we could do is on our new website, we have an alphabetical list of services, and we can just put under A, air quality, and have it linked straight out to the state's webpage.
That would be good. I'd really appreciate that.
No problem.
And then the other question that I'm getting from some constituents is, you tell us what the process is to do hotel inspections? We learn a lot about the food inspections, but can you tell us the process for hotel inspections?
So our environmental health section goes out and inspects hotels hotels, motels, lodging facilities, and we look for general sanitation. We go out once a year, and then anytime we receive a complaint about unsanitary conditions of a hotel, they look for just general cleanliness of the room. That we look at vacant rooms. We don't look at occupied rooms, and we make sure that it looks clean. That they have on-site laundry. We look at how they're doing their on-site laundry, how they're storing that bedding, and then if they have any other, like say glassware, and how they're sanitizing that glassware, we look at that.
So maybe something too as a potential project is there anything in any of our codes or stuff that would be helpful for change? So that's something maybe you can look at offline, but I'd like to work with you a little bit in that area.
No problem. Does another little update. So our food program is our biggest program, and so we have a lot of data on that. Our hotel program, and along with some of our other programs, we haven't taken our electronic system to count all the violations that happen. So, I mean, our system totally allows for it. It's just manpower to input it into the system. Then I could produce more reports rather than just how many inspections I did for our other programs. And it's been on the out there, but it's just manpower because it is not an easy. Our system is not the easiest to program, but we do have that capability.
Along that line, extended stay motels, how do you inspect those, especially if there's no vacancies and you only inspect vacant rooms?
Yeah. So what we ask is that when they do have a vacant room, if they can call us so that we can inspect that. We do respond to those extended stay for complaints if anybody does complain about those, and we talk to the management about proper managing of whatever the complaint may be, whether it be say bed bugs, or if it is a dirty facility or plumbing not working, or what we work with the management to make sure that those things get corrected. So Nikki wanted us to talk a little bit about the back in May. We had our 2015. She introduced the county health rankings, and so here this chart shows the health outcomes, and Carson City in 2015 was 4th overall. These health outcomes are based on 2 measures: how long people live and how healthy people feel while they're alive. This survey is done across the entire United States. It's not done by us, it's done by another agency, and this data gets published for every county in the United States.
I love our county to the south, Douglas. When we were talking about creating a health district, combining counties to do one, Douglas County told me that they had the highest suicide rate of any county in Nevada. Is that, one, do you know if that's true still? And 2, why doesn't that play into the health outcomes? Or does it?
I believe that it's not, they have the highest suicide rate among the senior population in Nevada is what I believe it is. I don't know, I'm not certain. I could find out pretty quickly, but I'm not certain that it's overall highest suicide rate. But for health outcomes, suicide does play into it, but it's all causes of death as well. And so the general measure of health outcomes is how healthy that population is. And if you have more folks dying earlier, you're going to get a lower ranking.
And then this chart talks about the health factors ranking, and in 2015 we were 7. These are based on 4 types of measures: health behaviors, clinical care, social, economic, and physical environment factors. in 2014, we were 5th. So in this particular measure, we did go down. But once again, these are people, they call people randomly and ask them questions, and so it is not necessarily the same people being surveyed every year. But once again, this is how they do this study for the whole United States. One of the things that this report recommended that we could do to explore to improve this ranking was look at adult smoking. So that's one. We have our tobacco program that are and doing our quit line 1-800-QUIT-NOW, and also working with our the apartment complexes and the other projects that our tobacco program is doing, and also looking at uninsured individuals, which go back to sort of the clinical care. And one of the things that we've done is partner with the state to help with to have a local site for people to enroll in health insurance at our facility. Some other things they suggested that we do is look at diabetic monitoring, high school graduation rate, and looking at unemployment rate, which, as the health department, we really can't control a lot of those things, but we can monitor those. And we do know, the unemployment rate has recently gone up, so that should help us with like the social economic factors next year when they do this survey. Oh, sorry, I meant down. More people are working. That's the up.
Speaking of that, we were 5th last year, we're 4th this year? Or was it
We're 7th. We were 5th last year, and we're 7th this year on this particular rank. And
This data is also, it's kind of interesting to look through. It's available nationally. Do you have the website in front of you? It's easy to access if I could remember it. But if you look for county health rankings, it'll link you to every state. And I had done a presentation in Douglas County a few months ago and looked at some of the adjacent areas. And for example, Douglas County, even though it is our healthiest county in Nevada, is only as healthy as the average county in Utah. So it's great in Nevada, but when we compare ourselves with more national types of figures, so of the 30-something counties in Utah, sort of the middle of the road county is as healthy as Nevada's healthiest county.
That means we're in the tank here then.
Well, yeah. So I don't want to be all negative, but I think we have to kind of look at it in context as well.
that's all I had.
Any other questions for you two? Thank you. Motion to accept the report?
I'll do it. I move to accept the director's report and give direction to staff on CCHHS activities, which we have.
Motion and second have been made. All in favor?
Aye.
Opposed? Thank you. We'll accept that report. Thank you for filling in for Nikki. And we will go on to an update of the Carson City Health and Human Services Strategic Plan, which, as MJ told us, is part of our overall health improvement project, but it affects not just us, it affects the certification in other areas as well.
Hello, for the record, Valerie Quape, public health educator at Carson City Health and Human Services. So what we do is the Carson City Strategic Plan is our organizational plan that addresses many of the community health issues that we are working on both internally and then also with external partners. And as a part of our accreditation process, we are required to review this plan on an annual basis to ensure that we are still moving forward, that we are addressing these issues, and to update the plan as necessary. A couple things that I wanted to address before I get into anything there. With the switchover, I believe, in encryption and then some other things, I think there was a version issue when the plan was sent to you. And under Appendix C on page 22 of the document that you were given, there was no content. The content has been retrieved in the final version of the plan. Also, there was some highlighting left on the heading for Appendix B, and that has also been removed as well. Just kind of also to clarify, the process for the annual review of the plan itself, we have some packets that each one of the division manager is given a packet to review the plan with their staff members so that staff have input as to what exactly the activities that their division is going to be responsible for, which includes a SWOT, what we call as a SWOT analysis. So SWOT stands for strengths, weaknesses, opportunities, and threats. So staff are given input as to what direction, what their division's weaknesses are as well as their strengths. From there, the SWOT analysis, the information from that is used to review that division's activities and objectives within the strategic plan. The packets are then sent to the staff member responsible. Hi. And I go through and I update the different objectives within the grid itself. So what we went back and forth as to how we want to report the actual progress as far as completed and abandoned measures instead of just measures that were new or changed. And some of the concerns were staff time. Some of the concerns were how would we make this usable and relevant for the community as a whole, because our requirements from FAB made it into this kind of very dry technical report that they wanted. And so what it came down to was we decided to do an internal report on an annual basis as far as the completed and abandoned objectives, as well as a summary of the ones that were revised and are ongoing. So that's kind of how those are reported upon, and that's how our plan is currently updated at this time. Were there any questions about that? No?
She did too good a job.
Okay. That's all I have for you guys.
What, hopefully you've had a chance to review that, look at that, ask questions, off grid, whatever, of either Valerie or myself or whoever is around. I think that the overall impression is that we are making slow, steady progress on our strategic objectives, which is it's a very positive thing. This was never meant to be something, okay, we're going to accomplish these goals in the next 2 years. It was meant to be, we're going to work steadily on some of these, get them off our list, and then be able to add others. So we very much value the board's input. All right, so I think we'll just have you sit there, Ms. Quape.
Need an action?
Oh, do I have to action that one too? Okay.
Ready? I make a motion to accept the updated Carson City Health and Human Services Strategic Plan.
Motion and second have been made. All in favor? Opposed? Excuse me. That will mean we'll accept that. Thank you. Still, you're not leaving. Our last item of business for the board today is our first lesson on how to impress the accreditation team that's going to come and inspect us probably in February of next year. Public health accreditation, as you've heard over and over and over and over, has been a long process. All the paperwork has been submitted. And the next stage is when a team of experts comes out to Carson City, goes through our paperwork, and has the option of questioning any of us, either on the board or at the health department, about the activities. We want to look good, Mr. Furlong. We want to look really good. So,
So we're not sending them to talk to Kenny.
yeah. So when you're off in February, you say? No. So what Valerie has put together here, we're calling the Public Health Accreditation cheat sheet, and she's just going to go briefly over it. We will have more of these, and at each of our Board of Health meetings, we'll just be talking a little bit about some of the questions that we, as Board of Health members, may be asked by the site visitors.
Thank you, Dr. Pinter. Again, for the record, Valerie Quape, Carson City Health and Human Services. So I'm going to keep this as brief as possible. I hope that you all have a copy of the cheat sheet with you, because I'm just going to kind of point to different areas within the cheat sheet as we go through the slides. just so you know, one of the reasons why this is so important is we're going to be having either small group or one-on-one interviews with the site visitors. The site visitors are not employees of FAB. They're actually representatives from other health departments within a leadership role that are acting as volunteers and as agents of FAB. At the end of their site visit, they put together a report that outlines their findings and how that contrasts against our documentation and how they can take everything as a whole. That is what gets sent to the Public Health Accreditation Board, FAB. And that is the only contact that FAB has with our health department to base their accreditation decision off of. So that's why this is so important. We are a small health department, and we have been working on this for quite some time, and we aren't perfect. We're trying every day to improve upon our weaknesses and really fortify our strengths. But we want to make sure that we reflect all of those positive things when we do have our site visit. So first and foremost, the purpose of the cheat sheet is basically to give a really brief 10,000-foot introduction to the basic principles of FAB and and how this kind of is implemented at our health department itself. This tool has also been given to all health department staff to use. We are using this as a part of our staff training as well. We've got some cool games and other activities for them to kind of make it fun and a little bit less arduous as we prepare the rest of our staff members for the site visit as well. Let's see, I think we'll go to our next slide. So first we're going to go to the top of the page, and here we have a very kind of colorful chart with our 10 essential services in the middle of the page, and then next to it the 12 FAB domains. And it's important to understand exactly what the 10 essential services of public health actually are. And I believe this has been brought up in other Board of Health trainings and orientations before, but this is basically the different areas of public health that we need to be addressing as an organization. This comes from a 1988 report by the Institute of Medicine called The Future of Public Health. It is available for free download if you are interested in going through the 150 pages or so. Maybe not, I don't know. But what the Public Health Accreditation Board did when they decided to devise a system on which each health department needed to be judged was they took these 10 essential services of public health, created coordinating the first 10 domains, and then because none of these 10 essential services directly look at administration and management, they then developed the additional 2 domains. So we have domain 11, which is administration and management, and then 12, which talks about our relationship with our governance, which is you all. So that's kind of where those 12 FAB domains are. I've heard some people who are new to FAB describe them as steps. They're not steps. They all happen at the same time, and there's different pieces that there's a lot of crossover as well. All right, moving on. We have our 3 prerequisite documents. These are the 3 large documents that you hear us talking about all the time, including our strategic plan. This is our community health assessment, or our CHA, our community health improvement plan called our CHIP, and the strategic plan itself. We had to submit versions of these with our application. So if you hear them talk about the 3 prerequisites, these are the 3 documents that they're talking about. And this is also why there's so much emphasis on these documents within our organization, because this is our roadmap as to our plans of what we're going to be doing. Next slide, please. So how does this all tie together, and what is the relevance here? So with this diagram, we have our community health status, which is then measured by our community health assessment, which then helps us develop our community health improvement plan, which then feeds down into our organizational strategic plan. From our organizational strategic plan down is really where we see a lot of the work from our boots on the ground staff members, our program and front end staff who are working every day to make sure that we are helping to improve the health of our community. We also have, you'll see at the bottom there, our quality improvement projects, which spin to help improve whatever our performance measures may be to ensure that we are trying our best to deliver the best programs and services to our community. Any questions so far? Okay. Next slide, please. So we do get a lot of questions about accreditation from staff members, and they generally boil down to one of these two questions. First of all is, why are we doing this? Why is this important? Which is a really valid question. And what it comes down to is it's important because it not only gives us an opportunity to see where our strengths are, but also to then see where our weaknesses are so that we can address them. If we have no level of measurement to see how we may stack up against other health departments or what the expectations of us would be on a national level, then maybe those are things that would be not addressed. We want to make sure that we are addressing our weaknesses. And this also helps us to, as you've heard me say before, really prepare for future grants and grant requirements and making sure that we are prepared to take on additional projects that may be necessary to address our community's health.
Sure.
Valerie, when I look at those frequently asked questions, and maybe it's just the way I read them, but it seems to me that, what's missing in the answers to those is, public health accreditation means that we've reached a level of providing service that on the ground creates a quality of life that is, or the potential for a quality of life that is better than elsewhere. Is that right or wrong? Or there's better, period?
That's better, period. The Public Health Accreditation Board states basically that the standards and measures and meeting the standards and measures doesn't necessarily mean that you've met a gold standard. It means that you've met what is considered a bare minimum, which is a little disheartening for some of us from smaller health departments because we may not have the resources to cover this broad spectrum of measures. At different conferences I've been to where I've had the opportunity to have conversations with people from even much smaller and more rural health departments in other states, this is not something that they're going to be able to achieve probably in the next 10 years. They just simply don't have the resources.
So if I'm out promoting the benefits of Carson City, and I said we're accredited by the public health process board, what does that mean to somebody? I mean, if I say that and I say, hey, you know what, we're accredited, does that mean we just got all the pieces in place but we're not doing anything on the ground?
No, that's not the case at all.
Okay.
It does mean that we have met that standard, at least that standard of quality, although FAB may not necessarily consider that a gold standard, but we have met a comparable standard of quality that meets national standards, which is a huge thing, particularly for rural health departments.
Okay, thank you. All right.
And say, I can never remember the numbers, but of the how many health departments are there in the country? 5,000 something or another?
Oh, probably more than that.
Yeah. Those who are meeting accreditation standards are in the 10 to 15% range, as I recall.
I would say maybe even less than that because there's approximately 75, there's might be 80 now that are accredited.
Right.
Total, including state health
I mean,
departments.
it is a point of pride, but FAB is very careful to say it's not a gold standard. And I think the reason they do that is because then they say, okay, well, then you're there and you don't have to try any harder. And they want to avoid that message. But I do think that we should be very proud that we are meeting these accreditation standards. And I will say as an aside that other health districts in our state are having difficulty doing that.
That's what.
We are still set to be the hopefully the first accredited health department in the state. So that is definitely a huge feather in our cap. We are a great deal ahead of the game in comparison to the other health departments. So that is a very exciting thing.
No, Dr. Pintar was just going to ask Valerie if she could explain the effect that accreditation will have on competitiveness for grants, especially moving forward.
That's often asked, and the official answer is that we don't know. The unofficial implication is that if a grantee sees that this health department has met that certain minimum standard, then that's something they don't have to delve any farther into looking at the operation of that health department.
My point was, I think that's one of the main tangible benefits, so to speak, Mr. Mayor.
All right, so moving on to our next slide. And this is also on that back side of your cheat sheet. What we've done is we've broken down the 12 different domains and then the general themes and major documents within each of those domains. This is not everything within each of those domains, obviously. There's a lot of different subparts and sub-reports and smaller documents that are also included, but we wanted to give you a feel for how all these pieces fit together, particularly within the context of our health department. This may look a little bit different for Southern Nevada Health District or for the state or for Washoe County, but here, this is how this is looking for us. You will not be expected to know all of these by heart, I promise. All right, next slide. All right, so future trainings. So what we are going to do is we are going to give you as the Board of Health more information about what exactly to expect from the site visit itself. What types of questions might you be asked? What are some good answers for those types of questions, and making sure that you have those tools and resources. Also, a little bit more detailed information about our processes and programs that you may need to know to answer those questions. What we're considering are either very small groups or one or two of you at a time, or one-on-one trainings. There will probably be 2 additional small trainings outside of the Board of Health meetings, if that is working for you. But ultimately what it comes down to is we also need to hear from you. What sort of format would you prefer? And then also if there's any additional topics or any burning questions aside from the ones that we're talking about here today, or maybe more detail about the ones that we're talking about here today, that you would like to be included in those trainings.
So I think what Valerie's asking, if there are areas, for example, the sort of financial review that Supervisor Bonkowski and Supervisor Shirk and I participated in, that was kind of an interest group within there. If for example, if you have particular interest in clinical services, then we would want you to know a little bit about more clinical services in depth, and then you would be pushed forward if there was a question about that.
Yes, a specific division or a specific program or policy or procedure or plan. We have lots of plans, as you know. So, any questions about that? And if and you can send those questions to us at any time, obviously.
Good. All right. So think about that, and then if there are, like I say, areas of interest that you want to sort of become the board expert on, that would be very nice. Anything else, Val?
I'm finished.
Nicely done. All right. Any more questions for Miss Valerie?
So do you want us just to contact you or let you know if we want to work on an area?
Yes.
Okay.
Yeah. Yes, please. All right. That was for discussion only. I'm finally figuring this out, aren't I? All right. And now I will entertain, before adjournment, any other public comment? Anybody have other things they want to tell me?
I just want to do a general one. Juan, you want to just come up and introduce yourself? This is the young man I discussed earlier at the board that I'm going to mentor in his senior project. So I thought maybe he could just introduce himself. You just have to push the button when you sit down there, and it'll turn the mic red, and you can introduce yourself and tell us what you're going to do for your senior project.
So just this one? All right. So I'm Juan Covarrubias. I am doing a senior project on, job shadowing a city supervisor, which is Lori here. And so hopefully I'm planning on getting at least 15 or more hours, basically seeing what it's like doing this job and what's in store. Yeah.
Future leaders.
Yeah.
Good luck, Juan. Thank you.
So, So is this in preparation for filing as a candidate in March?
No.
Got to do his 15 hours first.
Yeah. At least while registering as a voter. Come on, he's a senior. Good luck. All right, thank you. That means you have to put up with the likes of us, so I'm sorry about that.
Oh, no. Thank you.
Thank you. Other public comment? If not, Mr. Furlow, are you going to give us our motion to adjourn? Why, yes, thank you. Those opposed, nay. Thank you. Meeting adjourned.